The global south is struggling to bring down COVID-19 infection rates. The Delta variant, which has a higher transmission of between 30 to 60%, is becoming the most dominant in many countries, including South Africa, Indonesia and Zambia. As journalists continue to cover the pandemic, they fear for their own safety, as some governments do not recognize them as frontline workers.
Ever since the pandemic began, journalists have been on the front lines, and it's really necessary for them to get in that priority list, considering the risks that they have doing for work. For example, I was just out yesterday because a former president died, so I was exposed to a lot of people, and that makes it necessary for us to get access to the vaccines.
Thousands of journalists have been infected across the globe. Many of them have succumbed to the virus. Our Lesotho correspondent found himself fighting for his life after months of covering the pandemic.
South Africa was shutting the borders and not allowing people to cross without the COVID test, and people were sleeping at the border gate, and we were there to inform, to make sure that it does not turn into a super spreader. Mine was worse. I was hospitalized for up to 2 weeks with a severe condition. I was taken to Señorita Hospital in Mansoba. I'm still very grateful to those people.
The job often doesn't offer the option of working from the safety of one's home. Some journalist associations lobbied for their members to be recognized as frontliners.
It's important to include journalists as frontline workers because they are always there when it happens. They are there at state functions, they are there at press conferences, they are there gathering news, they are there in hospitals, they are there in army barracks, they are always everywhere where the news is. So it's very important to include them as frontline workers because they are the first port of call. Everybody requires news, everybody needs updates every day.
Some governments like Malawi and Indonesia agreed and changed the vaccine grouping and bumped up journalists to a higher priority group.
Initially, journalists were not targeted in terms of the COVID-19 vaccine, but then through our association, Mr. Malawi, we had to convince government to have journalists included among its key or high-risk professions. So in the third week of the administration of the COVID-19 vaccine, journalists in the country started getting the vaccine. However, I should mention the fact that without necessarily government making a formal announcement, but in the long run, the vaccine became open to all people that are willing to get the vaccine.
In Indonesia, the journalists were prioritized to get COVID-19 vaccine earlier than other people. So in my case, I already got my first jabs around in the beginning of March, and I got my second jabs in the end of March. I just thought that it really helps us to protect ourselves since this pandemic really hits Indonesia hard.
Less developed nations continue to beg for vaccines. The World Health Organization is frustrated that the COVAX facility, which aimed at equitable distribution, is failing due to vaccine hoarding by rich countries and manufacturers. Some governments may give in and include the median higher risk groups, but without the doses, how long will they wait for the jabs? Bolani, SABC News.